like-minded orthopedists striving to help not only themselves, but one another. With the latest video conferencing and educational technology, as well as a groundbreaking online platform, SICOT's pioneer events, activities, and resources are reaching every corner of the globe, with over 55,000 views of our webinars so far. We're forging new partnerships, signing agreements with 12 other international academic societies, and building an enduring network we hope will last for many years to come. So, what can you expect from us? Free webinars led by key opinion leaders from around the world and across all fields of orthopedic surgery and traumatology, as well as chat shows with some of the most interesting and inspiring surgeons on the planet. Opportunities to take an interactive role in these webinars by participating in polls and live discussions. Free on-demand Pioneer playback service. Watch our webinars again and again in your own time. And coming soon, our new bespoke learning management system will host podcasts, an online version of the famous SICOT diploma exam, virtual training modules, surgical technique courses, a discussion forum, and much, much more. We hope you'll join us on this pioneering journey as we push the boundaries of what is possible in online orthopedic education together.
Right, so very good morning, good afternoon, and good evening, ladies and gents, wherever you are in the world. I'm Vikas Kanduja, consultant orthopedic surgeon in Cambridge, UK. I'm one of the founders of SICOT Pioneer and the president-elect of SICOT. And it's indeed a pleasure to welcome all of you into this webinar from all around the world. Now, in this COVID world of non-contact domains, we've certainly embraced digital competitiveness with the launch of the SICOT Pioneer platform. And through this platform, we've done over 87 events, and I've had over 110,000 views from around 120 countries around the world. So big thank you for joining in and following us, and the fan following is around 9,000 at the moment. Now, we're all very well aware that the youth that you see on the screen today are our future, and today's webinar is focused on the role of the young surgeon forums in orthopedic associations like ours and many others around the world. We're ever so grateful to AJU BOSCO and Anna Rosenblum, who've actually gathered a stellar faculty from all around the world, and I'll let them introduce all of them to you in a minute. We will try and make this as interactive as possible, so please do post in your questions, and if you can't join us today, you can access it through our on-demand platform as well. Once again, a big thank you to all of you for joining in, and hope you enjoy the webinar. Over to you, Anna and Arju.
Yeah. Thanks, Vikas. Greetings from the Young Surgeons Committee of SICOT, and let me introduce Anna Rosenblum, who is my Vice Chair, and we from the Young Surgeons Committee take immense pleasure in inviting you all to this Young Leadership Summit. We have all joined here to address a very important issue, that is the challenges faced by young trainees and early career orthopedic surgeons in navigating their trainee period and early career, and how we can help them to navigate through this challenging period. And we are indeed privileged to have a vibrant group of young leaders from around the globe. And let me introduce Dr. Katherine Mallett from the AAOS Resident Assembly, Dr. Yudha Mathan Sakti from the Young Surgeons Forum of the Asia Pacific Orthopedic Association, Dr. Dimitra from the FORTE, Dr. Colin Yung from the Young Surgeons Forum of Hong Kong College of Orthopedic Surgeons, Doctors Janice and Natalia from the AMOB, Dr. MERRILL LEE from the Singapore Orthopedic Trainees Committee, and Dr. JENNA BERNSTEIN from the Young Arthroplasty Group of the American Association of Hip and Knee Surgeons. Without any further delay, let's begin with the first talk from Dr. MERRILL LEE. Over to you, MERRILL.
Okay, it's a huge privilege to be here at this forum. I mean, especially to meet Dr. Vikas, a big name in hip preservation, as well as Dr. Bosco. Now, I'll just move on to my topic. which is helping orthopedic trainees navigate challenges and lessons from my experience in Singapore. As part of the chairman of the Singapore Orthopedic Training Committee. The contents would be, firstly, challenges orthopedic trainees face across the world, what we faced back in Singapore, certain methods we have adapted to this climate, as well as what we hope for the future. So what are some of the challenges across the world? A quick literature review, of course, reveals that this topic isn't widely researched on, but Ludwig et al. In a Journal of Surgery and Research 2022 stated that in Germany, there's a lack of supervision, training, and oversight in the orthopedic residency system, and they cited insufficient trainer-trainee relationships, economic pressures where doctors have financial motivations, which affects the speed of surgery versus how much training the resident actually receives. And the authors concluded that in comparison to other countries, Germany shows the least structure and no mandatory course system. Whereas on the other hand, the Australians by Colin Yung et al. In the Medical Journal of Australia 2023 stated that distress among Australian orthopedic registrar trainees is common. And many trainees express career regret. Up to 20 to 30% felt that they would want to leave the career or they would want to pursue something else instead. And this was attributed to physician burnout. Elsewhere in the world, this is an article from BBC 2022, where Northern Ireland trainee orthopedic surgeons wrote into the health minister to state that there was a significant reduction in elective surgery, especially in Northern Ireland. And without this training, they would be unable to move on to a consultant position. And that their inability to provide training would severely compromise orthopedic service in Northern Ireland. How about over in the States? And a review article in the JEOS by Laporte et al. Identified 4 major themes of challenges to orthopedic residents. Firstly, they felt that there was a loss of professionalism and a shift to from patient ownership to shift work mentality, which means that once you're off, you're off. There's no more patient care. Secondly, too much emphasis on procedures. As surgeons, we all want to operate, but it is worth recognizing that clinic time is sacrificed due to mandatory case logs, and clinic time is where we actually hone our clinical acumen and skills. Thirdly, the lack of clinical experience, which comes from loss of what we term graduated responsibility, how much your mentor allows you to participate and allows you to carry out. And challenges with external oversight, where there's a lot of emphasis on activities of questionable usefulness, such as accreditation, as well as logbooks. Now, a brief overview of healthcare in Singapore is that we have 3 main healthcare clusters: the National University Health System, the National Healthcare Group, and SingHealth, which cover different aspects of Singapore, which is a much smaller country than the rest of our participants are from. Now, there are several hospitals and institutions belonging to each cluster, and seldom do residents from each cluster mix with each other. So what challenges do we as trainees face at home? Firstly, there's a lack of hands-on experience. Secondly, perhaps common to many other countries, there's the juggling of service work with research and exam demands. Thirdly, as mentioned, because we tend to be separated in different institutions, we tend to work in silos. And finally, there's a manpower shortage back home, where it's a delicate balance between the number of trainees as well as the work hour limits which have been imposed due to residency accreditation. Now, what have we done in order to try and attempt to address some of these problems? Firstly, the lack of experience. How does this come about? Firstly, elective cases are largely done by consultants back in Singapore, and there is therefore a lack of independence and graduated responsibility. As mentioned, this is mirrored over in the States as published in JAOS. Secondly, in the COVID years, there was a significant drop in elective cases. Our local experience has been published by my colleague, Dr. Fong in Acta Orthopedica 2020. And how we have tried to improve and work around this is to harness technology, such as using arthroscopy simulators, even though we know that we can never meet the real thing, but we can do simulation. There's arthroplasty and arthroscopy workshops held for the residents, which is cadaveric in nature, and of course, sawbone models and AO courses. With regards to service work versus academics, as a background, all of us residents have our own duties, which are weighed against research and exam commitments. Academics, we understand, is important for personal and institutional growth, but yet, on the other hand, service work will only continue to increase. In Singapore, we are faced with a silver tsunami of a rising aged population. It's expected that by 2030, 25% of our population will be above 60 years old. And secondly, there's a reduced number of applicants for specialist positions, which was noted also in the UK by the British Orthopaedic Association, as they published in a statement in 2020. What have we learned? Protected time is important for resident education. We have to fight for it. Protected time for training and academics. And then pooling and sharing of materials for residents who end up missing particular teaching sessions when they have to commit to their day-to-day duties. As for working in silos, as explained, each hospital in Singapore has its own strengths and weaknesses in terms of elective and non-elective work, as well as certain subspecialties. What the formation of the Singapore Orthopedic Training Committee has done is to give an avenue for residents from different institutions to mingle and exchange information, something which in the past was not present. This is facilitated by what we call out rotations to each healthcare cluster and allowing our residents to build bridges and ties between different healthcare groups. And such as, an example is our collaborative effort, termed the Singapore Orthopedic Research Collaborative, SORCE. And we'll move on to manpower shortage and work hours, which is, we've experienced back home a sudden drop in the number of orthopedic trainees. I'm unsure if this is the same in our other committees or other participants, where we dropped from 10 to 12 trainees to a batch of 2 to 3. My batch has 3 people. And therefore, on one hand, we are trying to adhere to work hours, and on the other hand, we need learning and patient ownership. It's a delicate balance where, in my role as one of the chief residents, we had to mobilize both junior and senior manpower to be flexible and accommodate in terms of workload. And it's crucial for program directors, as the leaders of the residency system, to be flexible at times with manpower and firm at others in order to protect their residents. What are our hopes as a community back home in Singapore? Firstly, we want to play a larger role in our education. We want to be advocates for welfare and well-being, especially as residents are trapped between work and academics. We would like to give residents a platform to seek career advice and build up a local and global presence. And finally, we of course hope to tie up with international residency committees. And of course, if any of the other participants here would like to reach out to us, please feel free to do so. And I think I've more or less hit my 6-minute limit. And this is the conclusions, where I feel that residency training will evolve with time. We have to harness technology such as simulation, 3D printing in order to show up weaknesses in training. It pays off to build a harmonious culture between institutions, and there must be a strong emphasis on mentorship and graduated responsibility for us to function well as surgeons. Thank you.
Thanks, Merrill. That was very insightful, and it throws light on the challenges faced by residents in your country. I think many around the world, it will be the same for many. So let me invite Dr. Katherine Mallett to share her experience on how we can navigate burnout and financial challenges in trainees and early career surgeons.
Good morning. Thank you so much for having me and for the privilege of being here and speaking a little bit about our experience in the American Academy of Orthopedic Surgeons and the Resident Assembly. So my talk is going to be based on navigating burnout and financial challenges. I could truly talk about this for an hour. We'll try to do it in 6 minutes. I have no relevant financial disclosures, but I do currently serve on a committee for the Academy of American Academy of Orthopedic Surgeons, AAOS, which is a lot easier to say. And I also host a podcast for the Journal of AAOS. So we are all fairly familiar with burnout. It's a syndrome. It was touched on a little bit in the last talk. Orthopedic residents have been subject to burnout and have been struggling with burnout, in addition to staff surgeons and consultant surgeons globally. So the syndrome consists of 3 main symptoms, so to speak. So decreased job satisfaction, emotional exhaustion, and depersonalization. And so there has been a lot of literature posted and published about burnout in both other surgical subspecialties and in orthopedic surgery. So in orthopedic surgery, one of the most comprehensive studies in the American literature is actually out of our Pediatric Orthopedic Society, POSNA. And they published a study where they surveyed all of their members, and they found that overall, over half of members did not feel burned out, but 46% did feel like they had less energy. Overall, they were under stress, but they were able to manage it. Almost 40% of members, however, did report high levels of burnout and stress. So this green box is around the members, I almost said patients, members who felt like they had less energy, they were stressed, but they weren't burned out. And then this red box is everybody who felt like they were burned out from moderate to severe. And interestingly, this graph on the right demonstrates that women reported higher rates of burnout, both personal burnout, and they also measured team burnout. So do you feel like your team is experiencing burnout in addition to yourself? So just briefly, what is the Resident Assembly and how can we help? So we are an advisory board to AAOS on issues of importance to orthopedic residents. We have delegates from each residency within the United States, and we provide a forum for residents to innovate, lead, embrace their roles as patient advocates and lifelong learners. So it's a really great opportunity for residents to get involved in the academy and leadership and advocate for their co-residents. So when we look at residents specifically, residents report pretty high levels of burnout. And when we look at what we do in residency, this makes sense. So almost 40% have emotional exhaustion. That's about equivalent to the staff consultants in the last study we looked at. 48% have depersonalization and 33% have decreased job satisfaction. The same studies saw that junior residents reported higher rates of emotional exhaustion and depersonalization, and residents on trauma rotations also reported higher rates of the same. So why do we feel burned out? One of the biggest factors is just a feeling of inability to meet our patients' needs. So we feel like we want to take care of our patients, but there are too many barriers to let us do that in a way that's safe and honestly practical. There's also a loss of sense of community with our peers. This, of course, has already been mentioned, changed with COVID-19. And then now as we've gone back into in-person meetings, it's probably gotten better, but forums like this are another way to build community and combat this. And then finally, there's diminished self-care, and self-care has never been the number one priority of residency. We all know that. But there has been more focus on mental health and wellness recently. And when there is not, it really does create a vacuum where you can feel lost. So how can we help? Number one, we need to preserve the doctor-patient relationship. And so this typically happens at an institutional level, and we can do our best at the committee level and national organization and international organization level to protect surgeons, protect physicians, and make sure we can take good care of our doctors and our patients and our doctors. We also need to build a professional community. So historically, there were a lot more in-person meetings, and there was a lot more shaking hands and having casual conversations and meeting people globally. Now we have to be a little more creative. So this is a great way, this webinar, to build a professional community. We have to cultivate collaboration at work, and we also have to refocus wellness and mental health programs. So a 6 a.m. wellness lecture is probably not the way to support wellness amongst trainees. But access to different mental health resources and even a free meal on a Friday afternoon shift is a great way to support wellness. So what are we doing in the Academy and the Resident Assembly? So we are trying to cultivate community among early career surgeons. So we have in-person events at the annual meeting, but we also have monthly webinars on career planning. And then we also have a mentor network that we're building where early career surgeons can collaborate with mentees who are residents. We also build career satisfaction through mentorship. So as I mentioned, near-peer advising is very important for this. We also host medical student forums. And when residents give back, they report higher levels of career satisfaction. And then we also advocate for residents at the academy level. And we're advocating actively for wellness and mental health programs for residents with program directors and academy leadership. So how can committees and organizations help? Much in the same way. So we need to focus on mentorship, building personal relationships between senior and young surgeons. And this benefits both and prevents burnout in both groups. We need to promote wellness, so advocating for practical wellness initiatives. So practical things like access to mental health resources at hours at work for trainees, access to healthcare, just being able to go to the dentist, and also social programs. So ways for people to get to know each other outside of the hospital. And then we also need to build community. So we want to spearhead programs that encourage collaboration, community, and teamwork beyond patient care. We care about our patients, but sometimes we need to see the forest outside of the trees. So I don't really have a lot of time to go into navigating financial challenges. I do want to just note that the average American medical student debt in 2023 was over 200,000 American dollars. So most surgical trainees have limited prior education in business and finance, and then they're graduating with a lot of debt. So what are we doing in our committee and the resident assembly? We host financial planning sessions for residents, both via webinars for people who can't attend the in-person meeting and at the in-person annual meeting. We also advocate strongly for resident salary increases that are at least on par with inflation in America. And then we also ensure free registration and travel to any academy annual meeting for anyone who is a delegate to the resident assembly or involved in the resident assembly. So essentially, we reward people who are involved in our group and advocating for their co-residents by giving them free registration and a free trip to our meeting. And this is a great way to build community and help with financial stress. So how can we do this as committees and organizations? I think providing travel grants for trainee meeting attendance is a great way to combat burnout and help financially. We also want to develop financial literacy and planning curricula for trainees. And then finally, we just need to advocate for fair trainee compensation as much as we can and loan forgiveness programs where possible. That was a lot. In summary, I'd just like to leave 3 points. We need to build communities amongst residents and consultants, promote wellness in a way that's practical and actually fits into our schedule, and then advocate for ourselves. Thank you so much for having me. This is the post-webinar survey on the right, and a reminder to register for the Congress.
Thanks, Katherine. That was awesome. A great talk and great to hear what you guys are doing with the AAOS Resident Assembly. I'm Anna COHEN-ROSENBLUM. I'm the vice chair of the SICOT Young Surgeons Committee. Again, honored to be part of this, moderating this webinar. So without further ado, we'll move on to Dr. Dimitra Melisaridou, who is coming to us from the Federation of Orthopedic and Trauma Trainees in Europe. And she's going to speak about the role of young surgeon forums in providing educational and fellowship opportunities for trainees.
Good morning, everyone. Good morning, everyone, and a lot of thanks for this kind invitation today. Can you all see my screen?
Yeah, you can press slide share, I think. We can see your screen.
Okay, thank you.
Yeah.
So my name is Dimitra Melisaridou, and I'm an orthopedic resident in the first department of orthopedics in Atikon University General Hospital in Athens, Greece. And I'm the president of the General Assembly table of FORTE. So the role of young surgeons forums in providing
Dimitra,
education. Yes?
Sorry, just press the play PowerPoint slideshow, okay?
Is that?
I think it's the bottom of your screen. Yes. Press slideshow.
Just a moment. Like this?
No. Sofian, you're there? Sofian?
Yeah.
Yeah, can you tell her how to put the slideshow, or can you put it for her?
Yes, if you can.
Just are you able on the small side, or maybe I can share on my side if you want.
You have the presentation, Sofian? Yeah.
Oh, thank you.
Yeah.
Okay, so thank you for this kind invitation. My name is Dimitra Melisaridou. I'm an orthopedic resident in the first department of orthopedics, and I'm the president of the General Assembly of FORTE. Can we move to the next slide, please? So the role of young surgeons forums in providing educational. Sorry. Thank you. So the role of Young Surgeons Forums in providing educational and fellowship opportunities for trainees and early career surgeons the way forward. So what is FORTE? FORTE is the Federation of Orthopedic and Trauma Trainees in Europe. We collaborate with a lot of orthopedic societies, and our main partners are the European Federation of National Associations of Orthopedics and Traumatology, elsewise called FORTE, and the European Union of Medical Specialists, elsewise called UEMS. One of our major events is the FORTE session in the EFORT Congress. In the annual EFORT Congress, this year was held in Hamburg in Germany, and we hosted a FORTE session with the anterior cruciate ligament reconstruction where our FORTE board members shared their experience. We also hosted the FORTE booth in the EFORT Congress to welcome new members. So FORTE and UEMS. What is UEMS? UEMS was established in 1958. It's one of the oldest medical organizations in Europe and has 37 members countries and is the organization of the EBIT exam. FORTE takes part in the annual meeting and contributes with one FORTE delegate. One of our groundbreaking events is the FORTE Summer School. This year, we held the 7th edition of the FORTE Summer School in June in Split, Croatia. We had 160 participants from all across Europe within an intensive week of learning, networking, and professional growth. We had 100 lectures divided in 2 courses by specialties in the field of orthopedic surgery. But as you can also see in the middle of the slide in this picture, we also hosted some social events. This photo is from the diversity cocktail in which we celebrated the contribution of female orthopedic surgeons in the field. One of the unique opportunities that FORTE offers to the members is the opportunity to join a FORTE traveling fellowship. In the past, I was lucky enough to be able to join the Pediatric Traveling Orthopedic Fellowship. I visited just within a week the University of Leuven, the Wilhelmina Children's Hospital in Utrecht, and the Erasmus Hospital in Rotterdam, in which I was lucky enough to take part in operations and meet the experts in the field. And in the following days, FORTE will be hosting the next FORTE Traveling Fellowship in Portugal, with the knee edition. But FORTE has a variety of other scientific activities. One of the very important congresses for us was the Sodomy Congress back in June 2023 in Palermo, Italy, where we discussed the impact of pandemic in our society. Other scientific activities included the IORS Congress in October in Catanzaro, Italy, where we took part with the FORTE Roundtable, and our contributions in the 41st annual meeting of the European Bone and Joint Infection Society in October, where we also took part with the FORTE Roundtable. Other scientific activities, as I already mentioned, we are in collaboration with a lot of orthopedic societies, including the one from Romania and from Italy. Therefore, we took part in the annual Congress of SOROT in Romania last October and in the AAOS Congress back in May in Catania, Italy, with a FORTE round session. Also, we were asked to take part in the practical course of orthopedic in Toulouse in France last June, and we also contributed with a joint webinar of the European Orthopedic Research Society and FORTE with new advances in ACL and MCL reconstruction. But FORTE is much more than just a federation. We try to represent the interests of our trainees. We try to improve connections with scientific societies, and we provide a basis for international links. We aim to promote research and development in orthopedic surgery through interdisciplinary coordination, exchange of scientific and technical experience, and education. Thank you very much for your time. And I would be happy to take any questions if there are.
Thanks so much. We're actually going to do some questions at the end. But that was a great talk. Interested to hear what y'all are doing. So next up, we're going to hear from Dr. JENNA BERNSTEIN, who is a practicing hip and knee surgeon at Connecticut Orthopedics and current chair of the Young Arthroplasty Group Committee of the American Association of Hip and Knee Surgeons. So thank you so much for joining us.
Thanks so much, Anna, and thank you to SICOT for hosting me. I'm really excited to be here talking to you all. So today I'm going to talk about how we get surgeon leaders from young surgeons and how professional societies can really take the step to groom young surgeons. So who am I? I'm a private practice surgeon in Connecticut. I do total hip and total knee replacements. I'm in my 5th year of practice, and I'm the chair of the American Association of Hip and Knee Surgeons Young Arthroplasty Group. And for those of you who don't know where Connecticut is, it's this tiny little red state right on the East Coast, and I'm about an hour away from New York City. So what is AAOS? So AAOS is the American Association of Hip and Knee Surgeons. It was established in 1991, and it really is the leaders in total hip and total knee replacement in the U.S., and we hope internationally, as this is really open to international surgeons as well. We have about 3,000 fellow members and around 6,000 now total members. And ascending to AAOS leadership is really the pinnacle of an academic career in the U.S. If you look through these names here, these are really some of the biggest names in arthroplasty surgery in the U.S., and looking at this, it's intimidating. How do I get to this point if I want to be a leader in my community, starting from first year out of fellowship? And so the Young Arthroplasty Group was developed to help young surgeons ascend in the leadership through AAOS. So at the time of the development, there were really few formal opportunities for young members to be involved in AAOS. We have a resident course, we have a health policy fellowship that existed, but neither of these really got you involved at the committee level. And there's no real pipeline at the time to get to leadership other than those with really clear mentorship in AAOS. If you had a mentor or someone that was at your job who was promoting you, yes, you could get involved, but otherwise it was very challenging as a young surgeon to get involved because you just wouldn't be selected for a committee. And then by the time maybe you would be because you were enough years in practice, you were already doing other things, maybe involved in other societies. So this was established to increase young surgeon involvement within the American Association of Hip and Knee Surgeons for surgeons in the first 5 years of practice. So our members are within their first 5 year of practice, fellows as well as residents. The first things that were done were a Twitter handle was established, which you are all welcome to follow, to promote some of the things that the group was doing. And they started with making primers really made to educate young surgeon on the pillars of AAOS and what AAOS is really doing for the hip and knee community in the US. Finally, with the support of the AAOS leadership, a formal committee was established. And this was kind of a big deal because you used to have to be a fellow member, which was at least 3 years in practice, to be able to be a member of a committee. And they actually changed the guidelines so that young surgeons could be members of the AAOS committee directly and serve on the board. And so one of the most important things that the AAOS leadership allowed the Young Arthroplasty Group to do is to become liaisons to other AAOS committees. And so what this meant is that during your time serving on the Young Arthroplasty Group, you would be a liaison to these different committees directly. And so these are committees that maybe it would have been hard to get on. For example, our advocacy committee is quite competitive to get on. And you could serve on that committee, see what they're doing, take part, and you can really prove, okay, hey, next time when I'm out of the Young Arthroplasty Group, here's another committee that I want to be on, and then people would know you. And so this really created a very direct pipeline for young surgeons to become leaders within our society. But then it's really blossomed from there. You know, Anna also has been a past chair of the Young Arthroplasty Group. And so this is really where a lot of our surgeon leaders in our committee are coming from. We have about 1,000 members now. We have a podcast that's a practice board review course for them that's free. We do an OITE, which is our in-service test review course, a webinar recently for those applying to fellowship about how to apply. We organize a social event at the AAOS annual meeting that's open to everyone. So if anyone attends, you're more than welcome to come. We have an educational event at the AAOS annual meeting, and then we have ongoing research, editorials, and really promote getting Young Arthroplasty Group members onto the podium at our meetings. And then what really is important, what this really is about, is that former YAG members continue to rise to leadership positions within AAOS and serve on other committees. So this is really a Kickstarter to make sure that we don't lose the best and the brightest because it's hard to get involved early. So in summary, young surgeons want to be involved, right? We all know this, we're all here. And it's really, we have to engage our senior surgeons in leadership to create a clear pathway towards being involved. It's not just going to happen. You can't just show up and sit on the sidelines, but you'll find that senior surgeons really do want to help figure out how to keep the best and brightest involved. And it's important to engage surgeons, not just in academics, but also in private practice and other employment models to maintain a large diversity of opinions. So any of you who are doing hip and knee surgery are more than welcome to join the Young Arthroplasty group, and you can do that on the AAOS website. And again, thank you so much for having me here. This is just a great way to get us all together and to discuss important topics.
Yeah, thanks, Anna. Thanks, Jenna. That was a wonderful talk, very insightful, and you gave us all valuable inputs on how we can inculcate leadership qualities in young surgeons, which is a very essential component to be a surgical leader. And moving on to the next talk, a very important topic that is a buzzword these days in almost all committees around the world, and over to the AMOB for their talk on diversity in orthopedics. Enough said, but has enough been done?
Good day, everyone. Can you hear me?
Yes, Janice, clear.
Let's just begin here. Okay.
Perfect.
Can you see the screen? Okay. Thank you for the invite. I'm Janice Guimarães and Natalia Sandin, that's here too. We are representing AMOB, Brazilian Association of Women in Orthopedics, and WOW, Women in Orthopedics Worldwide. Thank you so much for the invite. Inclusivity and diversity are popular words, even in orthopedics, but enough been done? In most parts of the world, female identifying students are 56% of medical students. How those women turn into such low numbers of orthopedic surgeons after graduation? What is still holding them back? Countries like Sweden, with current 21%, and Canada, with 13.6% of women in orthopedics are few. Most countries have only between 4 and 7%, including France, Chile, USA, Brazil, Japan, and South Africa. Unfortunately, in Nepal, Bangladesh, and Pakistan, less than 1% of orthopedic surgeons are women. Saudi Arabia is one rare example of a relatively fast growth of those numbers, ranging from 1.5 in 2010 to 11 in 2021. We have little data regarding the race of orthopedic surgeons in the literature. Currently, 7.8% of residents are Black or Hispanic in 2023. Despite current more applications of the minority groups, the number of trainees and faculties remains the same. That's what this group of researchers published in 2003, and they also asked, is this due to lack mentorship or implicit bias within the application process? In the United States residency programs, it is clear that there has been low or no significant increase in minority groups among residents in 12 years. That's what we see in this slide. The United States is also the country that publishes the most articles on diversity, equity, and inclusion. In 2023, those authors published an excellent review that found that 52% of articles on these topics are written by women, and there is also an increase from 3 to 9% of women being members of the editorial board of some of the most important journals of the country. Since 2009, the PERRY Initiative, a nonprofit organization, aims to recruit women into orthopedic surgery and engineering since high school and medical school in the US, based on mentorship and dismantling of the negative perceptions about orthopedics. Some papers from Canada and US also highlight the presence of women as annual meeting speakers on a similar proportion of their number in orthopedic societies in the US, and also the same aspect when considering women as leader positions in sports medicine societies around the world. Most of them are in the US and Canada also. Maybe there are better opportunities for women to train in North America. The example of Saudi Arabia. Saudi Arabia increased occurrence of road traffic accidents, obesity, population aging, and government-private partnership can be related to the higher number of orthopedic surgeons in Saudi Arabia. But to better understand the increase in female orthopedic surgeons in Saudi Arabia, I spoke with one, Dalal Bobshay, and she explained the actions that implemented in recent years, which may be connected to this increase. Visible role models, especially in social media, mentoring of medical students, including a career day, mentoring through research, the creation of the Fixers is that a kind of workshop that they based on Ruth Jackson Orthopedic Society, with 50% women leading the meetings. Now, our reality in Brazil. A mob was created in 2020, in the first year of the COVID pandemic. Today it's composed of 1961 members, and our goals are stay in the midway of this continent-wide country with geographic and socioeconomic differences, promoting a better and easier access for those women to connect with other orthopedic surgeons, provide data on the profile of minority groups and workplace conflicts, facilitate mentoring, and promote a safer environment for medical students, residents, and orthopedic surgeons, and to share activities of female orthopedics on social media. We also looked for the pioneers of each Brazilian state, and the differences remained large, such as the dates on which they became orthopedics. So you can see in 1969, Dr. Nair in the Northeast began working in the state of Pernambuco, and only in 2013 did the state of Maranhão have the first registered female orthopedists. This is a huge country, so it had a lot of work to do this, but it worth it. The AMOB Internship Facilitator Program aims to establish connections between medical students and orthopedic surgeons, while also providing professional and emotional support, identifying differences, and encouraging teamwork. Our initial contact is via application form, and then via email, SMS, and messaging apps. One of our biggest challenges is that few women act as preceptors in orthopedic medical residencies. And what's next? To keep working and breaking the gap, we want to encourage research, produce a booklet with guidance on possible adverse situations, expand the internship facilitation program, improve media resources. And you, what's the plan? Thank you so much.
That was a wonderful talk. Thanks, Janice. And now we have a question from the audience. Anna, you want to take that?
Sure. There was a question about how many organizations have a pretty large registration fee, which some people are unable to afford. So I was going to start with you, Jenna. Anything that AAOS is doing to help offset the cost of membership?
Yeah, so AAOS has a really strong interest in growing our international membership. Actually the price has been reduced for international members to $100 for just this reason. And just for comparison, in the US, we pay $600. And additionally, for resident members, if you apply before December, it's actually free to become a member.
Anna? Okay, thanks for that information, Jenna. And Katherine also says that the AAOS has introduced a new sliding pay scale for international members, and And if the national delegate of any society can write to them, and they can help in help trainees or young surgeons to utilize that. And I would like to ask Dr. Colin Yung. Thanks, Colin, for being here.
Hi, thank you.
Yeah, nice to see you. How has involvement in your specialty society helped you in building your career? And how can you say that this will be a model for other young surgeons to get more involved in societies?
Well, I'm from the Young Fellows Committee in Hong Kong, and it's a direct extension from the Hong Kong College of Orthopedic Surgeons, which is our main governance and exam board. And as a voice of the young fellows, we represent our residents and young fellow body in this collegiate board. So a lot of our senior surgeons, senior colleagues will therefore know of you and recognize your active involvement in education and orthopedic development in the region. So you're also involved in all the council meetings, you get firsthand information. And if you are into education, they will find you. They will find you for more participation in academic events and social activities. And so networking and exposure is a huge aspect for your career development. So I would strongly encourage all young fellows to really get involved in the young fellows committees or whatever societies that you have. And those are very interesting and challenging. Another thing is involvement in some professional societies. For me, I'm a trauma surgeon, and I'm a specialist in trauma, so I'm involved in the AO Foundation, and this has been a huge part of what I do as well. Being a part of the AO Trauma Hong Kong Council as a research officer has led to many opportunities. You get to share your passion for education, and you get invited to internationally to go abroad for their education activities. And this has led to more opportunities in research as well, funding from such societies, as well as personal development and traveling fellowships, overseas presentations. So it's essential to get involved and be active, and don't be afraid to be social, but there are a lot of commitments and time away from family. So that's the downside to it. And yeah, thanks for the question.
Okay, great. And Yudha from the Asia Pacific Orthopedic Association. Yudha, I would like to ask you how mentorship has helped you in your career, and what role has it played, and how important it is to have a mentor or many mentors as a young surgeon.
Okay, thank you very much, Dr. Aju. Greetings, everyone. I'm Yudha from Indonesia. I'm the chair of the APOA YSF, that's a Young Surgeons Forum. Actually, this is the second term of YSF, so it's quite a new thing, and it's really glad to see everybody really excellent in the way in advocating for the young surgeons, the young surgeon community. So in the APOA, for the leadership, it is something that we are our organization is supported by at least 24 of the Asia Pacific countries, and all of the young surgeons get the opportunities to send a representative in our society, in which the leadership started from there. So first, the international leadership or international mentorship, to say, condition is from the head of the delegates of each country have one representative from the young surgeon to be active in the YSF community. So it's part of the mentorship itself in being active in the international societies. That's a really good mentorship. But we also encourage each of the countries to have the mentorship within their designated countries. So the mentorship really improves us not just in knowledge and practice as an orthopedic surgeon, but also to be active in advocating and being active in giving a sound to young surgeons and their interest to excel in the orthopedic world. So mentorship in our societies is pushed by two ways. That's one of the society's ways in being active, and also being excel in our practice as an orthopedic surgeon. So and it's really helped us in our society being active, like previously mentioned by the previous speakers, that being active in our Young Societies Forum or YSF can lead to our achieve our increase in the ladder of leadership in our bigger societies. I think that's really important and what we've been advocating in our societies. Thank you very much, Dr. Raju.
Yeah, thanks, Yudha. And I would like to ask one more question. APOA is one another big regional association which has a lot of members from different countries. What special programs or initiatives you have for promoting inclusivity and diversity?
Yeah, thank you very much. So inclusivity and diversity is something that's really, I see a lot of from the previous presentation, it's something that we heard a lot, but we need to do more in a way that the percentage, for example, a percentage of the APOA now have WAVES. WAVES is the Women Advocate Education. And also being active, it's they are serving their first term in the APOA, in which inclusivity is being advocated and protected in our society. And also WAVES is also being involved in every activity of each of our subspecialty organization. For example, if you'd like to have some kind of a meeting, you kind of have to involve the WAVES so that inclusivity is there. So that's one of the group that's being also protected or in a way involved in our activity as inclusion. And then for the diversity, I think us in Asia Pacific is really very much diverse. However, there are some conditions in which we need to advocate again by doing a lot of socialization, a lot of we are trying. This workshop is one of the things that's also we circulate in our society so that we understand that the diversity, inclusion is something that we need to think of. Moreover, in our residency program, because sometimes. I don't know I think in Western is much more developed, but sometimes in our country, paternalistic education is something that need to be also addressed in a way by socialization, by exposing our faculties to this condition, so that we can in a way transform in a nicer way to prevent or to prevent worse thing or bad thing that can happen due to the negative impact of diversity, not thinking about or not doing about the diversity and inclusion in our residency program. So it's one of the things that we also support in our society to be socialized in our region. So in our Asia Pacific region.
Okay, great. Anna, you have any questions?
Question? Yeah, generally for the panel, you're all very involved in your societies and have done a lot. And the common theme I heard as well, early career, say yes to everything. But there's a limited amount of time, as a trainee or as a practicing surgeon. So how have all of you prioritized which commitments to accept, strategize sort of which opportunities are the best, and any advice for attendees watching, how can they pick which opportunities to be involved in?
Anyone wants to take that question?
Or maybe you're like me, you just say yes to everything and then all of a sudden you have no free time. I don't know, but there's got to be a better way.
It's a good question, Anna. I think you kind of have to know yourself a little bit and what your priorities are. And I think that's the first thing is self-recognition of what are my goals. If your goals are not an academic career, then maybe the things you're getting involved in are working with industry, things like that. If you want to get more involved with your society, you pick that. You can't pick everything, right? So like Katherine talked about being involved with the AAOS. I do very minimal things with the AAOS for me. AAOS is the more important one. I'm involved in my state society because we were able to make legislative changes. But you kind of have to choose what you think is important to you and then stick with that. It's okay to try everything at the beginning, but after a year or two, that's when you start saying, no, I can't take that many days off of work.
Okay. So I think this Yudha, you want to say something?
Yeah. Again, I just there are a lot of societies, and something that's come up also in our young society, young students, in which society should I take? So it sometimes creates But the thing is, this collaborative association thing or collaborative society meetings like this is something that's in either societies that they will choose, they can also excel and collaborate. I think this kind of meeting, I congratulate Dr. Aju and Dr. Anna for having this, because each steps or each society that they take will end up with this kind of a meeting in which we will in the end we will also meet and we have understanding in what we are doing. So either society is good. What's better is good socialization, and the end of the collaborative meeting. It's very good. Thank you.
Okay, and I think this this meeting is a testimony that we have done the job and we've been torchbearers for advocating diversity and inclusivity. I'm happy to see that we have a good proportion of women and men and from all parts of the world. And I think I should express my heartfelt thanks to all of you. All of you have come here despite your busy schedule, and all of you have spent your time. And thank you so much for being here. And we will update you on a summary of this webinar. And I hope that we come up with a publication, all of us, about how we can address these issues. And those who are interested, do join the SICOT Orthopedic World Congress, and we'll keep you updated on further meetings like this. Thank you for all of you for coming again. Thanks. And Sophian, should we have a screenshot photo of all of us? I think this is the first meeting of its kind. Sophian?
Yes, of course. We can do it when we close the live.
Yeah, I think we've concluded. And is Vikas joining us?
No, he already left.
Finally, we can see Natalia. She's been busy.